If you are currently taking Amlodipine, Losartan, or Lisinopril for your blood pressure, I need about 20 minutes of your time today because there are 6 things happening inside your body right now, quietly, that almost nobody explains to you in a rushed 15-minute appointment. Not because anyone is trying to hide anything from you, but because most doctors simply don't have the time, in between checking your blood pressure number and writing the next prescription, to walk you through what these medications are actually doing underneath the surface, month after month, year after year. By the time we get to number 1 on this list, you are going to understand your own prescription bottle better than most people ever will. And more importantly, you'll know exactly what questions to bring to your own doctor at your very next visit. I'm Dr. Hale Thorne. I've been practicing medicine for more than 30 years now, and blood pressure management has been a part of nearly every single day of that career because, frankly, it's one of the most common conditions I see walk through my door. I've prescribed these exact 3 medications more times than I could possibly count. And I'll tell you something honestly, my own blood pressure isn't exactly what it was when I was 30, so this isn't me lecturing you from some untouchable place. This is 2 people who both understand what it's like to glance down at a pill organizer every single morning and wonder, quietly, what is this thing actually doing to me, beyond just the number on the cuff? Before we dive in, I want to ask you something, the same way I'd ask a patient sitting across from me in my office. Down in the comments, tell me which of these 3 medications you're currently on, Amlodipine, Losartan, or Lisinopril, and how long you've been taking it. I read every single comment on these videos, and it genuinely shapes what I decide to dig into in future videos like this one, so don't hold back, and don't worry about getting the spelling exactly right. I've seen patients butcher these names in my office for 30 years, and we always figure it out together. Alright, let's walk through this together, starting with number 6, and working our way down to the one I consider the most important of them all. Number 6 is swelling in the ankles and feet, something we call edema, and this one is particularly common with amlodipine specifically. Here's what's actually happening. Amlodipine works by relaxing and widening your blood vessels, which is wonderful for lowering pressure, but it tends to widen the small vessels in your legs more than the ones returning blood back up toward your heart. The result is fluid that pools quietly in your lower legs by the end of the day, almost like a small traffic jam happening at the exit ramp while everything coming in flows just fine. I've had patients come into my office absolutely convinced they were developing heart failure, only for us to discover it was simply their amlodipine dose needing a small adjustment, or in some cases, just a different medication entirely. I remember one woman, a retired school teacher in her late 70s, who told me she'd started buying her shoes a half size larger because she assumed her feet were just getting older along with the rest of her, the way feet sometimes seem to do. It never crossed her mind that the small white pill she'd been taking for 2 years might be the actual reason. We adjusted her dose, and within about 3 weeks, she went back to her regular shoe size and called my office just to tell me about it, which doesn't happen very often, I'll be honest. If you've noticed your socks leaving an indent around your ankle by evening, or your shoes feeling tighter as the day goes on, that's worth mentioning at your next appointment, not because it's dangerous on its own, but because there's often a simple fix. Elevating your legs in the evening helps somewhat, but an adjustment to the medication itself usually solves it far more completely. And you genuinely don't have to just live with it the way so many people quietly do for years without ever bringing it up. Number 5 is a persistent dry cough, and this one is closely associated with lisinopril and other medications in that same family, what we call ACE inhibitors. The mechanism here is actually fascinating if you think about it. These medications work partly by affecting a substance in your body called bradykinin, and in a percentage of patients, that same mechanism irritates the lining of the airways just enough to trigger a dry, tickly cough that has absolutely nothing to do with a cold or allergies. It tends to show up weeks or even months after starting the medication, which is exactly why so many people never connect the dots themselves. I've had patients try cough drops, allergy medication, even antibiotics for what they assume was a lingering infection or a stubborn case of seasonal allergies, when the entire time, the real culprit was sitting in their morning pill organizer the whole time. One gentleman I treated, a retired postal worker, spent nearly 4 months convinced he had some kind of chronic bronchitis, went through 2 rounds of antibiotics that did absolutely nothing, before anyone thought to connect it to the lisinopril he'd started right around the same time. The good news is, this particular side effect almost always resolves completely once the medication is adjusted or switched, usually within a few days to a couple of weeks, and most patients describe it as one of the most satisfying fixes in all of medicine because the change is so fast and so complete. So if you've developed a cough that started right around the same time you started this medication, and it just won't quit no matter what cough syrup you've tried, that timing is not a coincidence, and it's absolutely worth a conversation with whoever prescribed it. Number 4 is fatigue that feels different from ordinary tiredness, a kind of heavy, foggy exhaustion that doesn't fully lift even after a full night's sleep. This shows up across all 3 of these medications to varying degrees, because lowering blood pressure, even when it's medically necessary and genuinely beneficial, means your body is adjusting to less force pushing blood through your system, and that adjustment period can leave you feeling like you're moving through molasses for a few weeks. Most patients adjust within a month or so as the body recalibrates. But here's what concerns me. Some patients simply assume that's just what getting older feels like, and they never mention it. I think about the men in my practice who used to walk the golf course every Saturday morning without a second thought, and quietly stopped going, not because anything dramatic happened, but because that particular tiredness just made the whole outing feel like too much effort, and after a few missed Saturdays, it became easy to just stop going altogether. Nobody connected it back to the new prescription bottle in the cabinet. They just assumed it was age catching up with them. In reality, a simple conversation about timing the dose differently, perhaps taking it in the evening instead of the morning, can make a meaningful difference in how a person feels throughout their entire day. And I've watched men get back out on that golf course within a matter of weeks, simply because we moved their dosing time by 12 hours. Number 3 is something that catches a lot of people off guard, and that's a noticeable drop in potassium, or, in some cases, a rise in potassium, depending entirely on which of these 3 medications you're taking and how your particular kidneys process it. Losartan, for example, tends to cause potassium to rise slightly in some patients, while certain other blood pressure medications can cause it to drop. Potassium is involved in literally every single heartbeat your body produces, every muscle contraction, every nerve signal firing correctly, so even a modest shift outside the normal range can show up as muscle cramps, an unusual heartbeat sensation, or a general sense of weakness that doesn't have an obvious explanation. I had a patient, a woman who loved working in her garden every morning before the sun got too hot, who started getting calf cramps so severe they'd wake her up in the middle of the night, and she assumed it was simply from kneeling too long pulling weeds. Blood work told a completely different story. Her potassium had drifted outside the normal range months earlier, slowly, quietly, without a single other symptom to warn her. This is exactly why your doctor periodically orders blood work while you're on these medications, not as a routine formality, but because this specific number genuinely matters, and catching a shift early, before it becomes uncomfortable, is so much easier than catching it after months of unexplained cramping in your calves at 3 in the morning. It's also worth knowing that certain foods, bananas, oranges, potatoes, can shift this balance further, depending on which direction your particular medication pushes things, which is exactly the kind of detail worth discussing directly with your own doctor, rather than guessing on your own. Number 2 is a change in how your body responds to standing up quickly, sometimes called orthostatic hypotension, where you feel a brief wave of dizziness or lightheadedness when you go from sitting to standing or from lying down to sitting up. All 3 of these medications can contribute to this, simply because they're doing exactly what they're designed to do, lowering your blood pressure, and sometimes that drop is slightly more pronounced in the few seconds right after a change in position, before your body's natural reflexes catch up and stabilize things. This is especially noticeable first thing in the morning, or after getting up from a long stretch sitting in a recliner watching an evening of television, when blood pressure is already naturally lower than usual. I always tell my patients the same simple trick. When you get up out of bed in the morning, sit on the edge of the mattress for a slow count of 10 before you actually stand, and if you're getting up from the couch after sitting for a long while, the same rule applies. Pause for a moment before you commit to standing all the way up. It sounds almost too simple to matter, but I've had patients tell me it's prevented falls they were genuinely worried about, especially first thing in the morning, when blood pressure naturally tends to be at its lowest point of the entire day anyway, and a fall at 75 or 80 carries risks that simply weren't on the table at 50. And number 1, the one I genuinely believe deserves far more attention than it typically gets in a rushed office visit, is the effect these medications can quietly have on kidney function over the long term, particularly with Lisinopril and Losartan, both of which work in part by affecting how your kidneys filter and process fluid. For the vast majority of patients, this effect is actually protective. These medications are frequently prescribed specifically because they help shield the kidneys from the damage that high blood pressure itself can cause over time. So in most cases, this medication is quietly doing your kidneys a favor every single day, not the opposite. But in a smaller percentage of patients, particularly those with pre-existing kidney concerns, or those who become significantly dehydrated, perhaps during a bout of illness, or simply a hot week without enough water, that same mechanism can occasionally push kidney function in the wrong direction temporarily. I think of one patient, a man who'd been doing wonderfully on his medication for nearly 6 years, who came down with a stomach bug over a long weekend, barely able to keep water down for 2 days, and didn't think twice about continuing his medication exactly as prescribed. By the time he came in feeling weak and foggy, his kidney function had shifted noticeably. Not permanently, thankfully, but enough to require a few days of careful monitoring and fluid before things settled back to where they'd been. This isn't an argument against the medication. Quite the opposite. It's an argument for understanding that this particular medication asks a little more of you during illness than some others might. Simple things like staying ahead of your fluids when you're sick, rather than assuming you can simply push through it the way you might have at 40. This is precisely why your doctor checks your kidney function through blood work periodically while you're on these medications, and it's exactly why staying properly hydrated, especially during illness or hot weather, matters more for you than it might for someone who isn't taking a blood pressure medication at all. This isn't meant to frighten you. Quite the opposite. It's meant to put real, useful information directly in your hands, because in 30 years of practicing medicine, I've found that patients who understand what their medication is actually doing tend to manage it far more successfully and with far less anxiety than patients who simply swallow a pill each morning and hope for the best without ever asking what it's actually doing for them or to them. Now, a quick pause here, because if you've made it this far in the video, you're clearly someone who takes your own health seriously, and that already puts you ahead of a lot of people. Go ahead and tap that like button if this has been useful so far. It genuinely helps this information reach more people who are managing the exact same medications you are. And let me know down in the comments, out of these 6, which one you've personally noticed or which one completely surprised you. I read every single comment, every time. So here's what I want you to take away from all of this. None of these 6 things mean you should stop taking your medication or panic about what's sitting in your pill organizer right now. Blood pressure medication, taken consistently and correctly, adds years to your life and meaningfully reduces your risk of stroke and heart complications. That part isn't in question at all. What I want, more than anything, is for you to walk into your next appointment armed with real questions instead of vague worry. To say to your doctor, "I've noticed this specific thing. Could it be related to my medication?" instead of simply wondering about it quietly on your own for months, the way so many people do. Before you go, if you know someone who's currently on one of these 3 medications, a spouse, a sibling, a close friend from church, send them this video. Most people have absolutely no idea these 6 things are even connected to their prescription, and that single piece of awareness could genuinely change how they feel day to day. And if you want to know the one specific time of day that I tell nearly every single one of my patients to actually take their blood pressure medication, because most people are taking it at the wrong time without realizing it makes a real difference, that's exactly what I'm covering in the very next video, so don't miss it. This video is intended for general educational information based on clinical experience and published research, and it is absolutely not a substitute for an actual conversation with your own prescribing doctor, who understands your complete medical history far better than I ever could from all the way over here. Take good care of yourselves, and I will see you in the next one.